So it should be good. Okay. Well, thank you. Yeah. And welcome to everyone that's here. We want to talk to you today a little bit about something that we call optimal aging, or some lifestyle medicine that is a little bit different, a little spin on traditional medicine. Obviously, it does come from my background in bioidentical hormone replacement therapy. So we're going to touch on a little bit of the medicine aspect of it. I'm going to try to give as much information and tips that are that can be just done without even seeing a doctor. So things that we need to know that we can do now to help us as we age, to age a little bit better. And then some of it will be a little bit more medical, in which you'd have to see a physician to get some additional treatments or medications or things like that. But we'll limit that to this for this talk and talk about the things that we can control even on our own. So I do have a PowerPoint. I'll see if I can put it up on the screen, and then we'll go from there. It is telling me something. Okay. Let me see. I don't know if you guys can see that or not. Can you see me or just see the screen?
Just you.
Okay.
I forgot I was muted.
Me too. Share screen. Sorry.
I think that's fine, because honestly, I think we all hopped on Zoom and we all have limited knowledge, but there's always these little things that we're still learning.
Yeah, and if it doesn't come up for you, I can certainly, you can just see me. It's just, and I can get it to you, Amanda, too. It's bullet points, really, and most of this is talking.
Right. Yeah. If it doesn't come up, then what you do is just send it to me, and I'll send. If it's a PowerPoint, I'll send it out to everybody. So
exactly, yeah, because it's simple enough, here as far as the slides. I didn't really put that much on the slides. I just wanted them to be as a reference for me and for folks, and they can still see it. You'll be able to jot down some notes if you're interested in that. But so, like I said, most of all, what I want to share with you is tips and things that you can do on your own. Some of it requires additional treatment from a doctor, but let's go ahead and so there's a quote from George Burns that I like that says, "You can't help getting older, but you don't have to get old." So we're all aging. We know that because we're not as young as we were yesterday or 1 minute ago, and things happen as we age. Naturally, they happen, and what we're trying to do is intervene and take a little different approach than what traditional medicine will do. So when we look at what is optimal aging, we look and see, why do we have wrinkles, get wrinkles as we age, or bruise easily, gain weight, have painful joints, sore muscles, lose our flexibility, have difficulties with sleeping and lack energy, etc. Why do we get sick and have more difficulties getting better from infections and stuff as we age? So one of the reasons for this is there's a significant decline in our hormone levels that occurs naturally. So that happens to everyone, and so we all get to experience this, and that's one of the big factors in which we age. I'm going to talk about 3 principles, and that'll be the little bit of the medical side of things that happen as we see this decline in hormones and the reason for all those signs and symptoms of aging that we see. It's different from traditional medicine. And at traditional medicine, what we would normally do, we would treat disease. So we'd have somebody come in, we'd see them, diagnose them with hypertension or high cholesterol or diabetes, and then we'd treat them. So we'd offer them a medication to combat that disease once they've already acquired it. So if we can age better, and we'll talk about how we do that, maybe we can have a more of a preventative or prophylactic approach to how we live life and how we get older and avoid some of those medications or diagnoses that we don't necessarily want. So we're not trying to treat disease, we're trying to manage the aging process here. So I'm going to look at my slides, even though you can't. Sorry. So a couple of principles for health. These are simple concepts or words, but the concepts are big and involve the body, right? So we want to optimize these 3 principles at the cellular level. Okay, so number 1 is we want to control inflammation. We want to deliver proper nutrition, and we want to have proper energy production. So I want to see that at the cellular level from the start. And so we have to optimize those 3 principles in order to age gracefully or optimally age, so that we don't have, these disease processes as we go and get older. If we're lacking in any of these principles, we will see a breakdown, and that's whenever we see disease or injuries or pain that will come. So that's what we're trying to do. We want to achieve optimal aging, and the big one is inflammation control. Whole body inflammation or free radical oxidation. So we've heard of free radicals. We heard the terms antioxidants, and we know that this process of oxidative stress, so that's a big word, but is detrimental to our cells and even to the DNA level, to the protein production level. As we see damage at these levels, that's when we see over time that results in disease. So we want to control inflammation. We want to be able to deliver proper nutrition to the cells so that they can function well, and then the cells will be able to produce energy so that we can do the work that we need. Not physical work, although that is part of it, but actually the work to repair and heal from everything that has happened to us during that day or that cell during the day. So we want to control inflammation as best we can. So a rapid decline in our hormone levels has consequences. And we can study this, and we can see the data. It says that even as at the age of 30, young age of 30, we start to see a rapid decline in hormone levels, certain hormones that are really important to these processes. And one way I like to think about that is if we are, when is the time in life that you remember that you were the most healthy or invincible or, couldn't get hurt, etc. Maybe age range 16 to 24. Think of that age range and think of your health at that time. And then if we would look at and see your hormone levels for various hormones at that time, they were through the roof, actually greater than what we would call even a normal range at times. So hormones play an important role in the way our body functions, the way we're able to heal and recover at the cellular level from our day's work and activities. So that's some of the principles that we're trying to think about as we go through some of these. We're going to go through some scenarios here with hypothetical patients. In next, we're just going to talk about how do we combat this aging process. So this is the insider information, reduce the symptoms of aging. A lot of this are things that we can be doing now that don't require us to change a whole lot about or see physicians per se. We just need to make sure that we're doing these things properly, and we'll give some tips on how to do that. So the first thing is probably one of the more important things is sleep. So we want to improve the quality of our sleep. Sleep is so important that, and it's maybe one of the last things that we consider in our day, or we're so busy that we're doing all these things, and then we get a little bit of rest or sleep and then expect to be able to do it the next day. So that is not exactly an approach that we need if we want to age well. And so this is difficult because of lifestyle, because of the way we live at this point, you know, in America or in this world. Sleep is so important though. So some things with sleep that are helpful as far as the quality of sleep that we get. And as we go through this, I will mention some things about sleep that are so important for us. But a couple of principles. We want to set a schedule. So we would like to go to sleep and have a period of time of relaxation, if we can, before. And one thing that you can do now, and go to the store, any drugstore, pharmacy, Walmart, Target, anything, and get is melatonin. So melatonin is fantastic. It is, like I said, you can pick it up. It is an antioxidant. We talked about the oxidative stress. So it is an antioxidant, but it also helps us with our sleep-wake cycle. And take that, have a half hour to relax, and go to bed, and make sure you're asleep before 11 o'clock at night. So we want to sleep. We want to get into our first cycle of sleep. And then at the end of the first non-REM cycle of sleep, we have the greatest release of a hormone naturally called growth hormone. This is a very important hormone that we want to release at the highest amount that we possibly could. So we want to sleep. We want to be asleep at 11, get that huge release of growth hormone. That will help us with our recovery from anything we did that day. It'll give us the best chance of recovery. So those things we can do. Whenever we go to bed, we should have, our bed should be in its own place. We don't want the computer screens on and the TVs going and lights and this and that. We want it to be a dedicated space. We're going to avoid caffeine, nicotine, alcohol, those things late in the day. And some of the other things, exercise, and we'll come back and we'll review these things time and time again, but exercise, some consistent type of exercise, a walk, so some activity that is consistent will help our sleep. Okay, so that's important to us, and have a regular schedule towards our sleep pattern. So that's the mention of sleep right now. We want to also protect our immune system function. In one simple way that we're going to talk several ways about this, but one is sleep. Okay, so that helps our immune system function. The other is something also that you can get at the store, very simple, is vitamin D. So vitamin D, you can pick up the store, take a capsule. Most of us are insufficient, in our values here in the Northeast, because we get vitamin D is made really by the skin from sunlight. So sun exposure. So we don't get quite as much right now. We're a little bit better because of our summer months. But as we get into the fall and winter here, we're going to see immune system and immune function be so important. And that's whenever we see more of our problems with colds and viruses, etc., infections. So vitamin D you can take. It's fantastic for the immune system. What we know are there are receptors on every cell in the immune system that are vitamin D receptors. So those receptors are there, but if we have insufficient vitamin D and vitamin D doesn't attach in that receptor, it won't activate that immune system response. So to have a healthy and functioning immune system, vitamin D is important to us. Combat the aging process with decreased body fat and weight loss. So this is a principle that we all know that we want to try to do our best with. And probably the bigger part of this, as far as diet or exercise, would be the diet. So we want to make sure we're getting fruits and vegetables. We talk about it a lot, but it is true. We're in this fast food society and Starbucks and the sugar highs and all these things. So we want to fruits and vegetables, watch our diet. One simple type of nutritional plan that's not necessarily a diet, but really helps us look at what we're eating is if we look at the nutrition labels and have a total calorie diet that we want for the day, and then break it up into what's called macros, or carbohydrates, protein, and fat. So if you look at the total calories and then look at your carbohydrates, fat, and protein for the day, carbohydrates could be around 40% and 30% for protein and fat. And if you look at that, even if we do that, if we have our patients or, you know, our folks doing that, they're looking at least at labels, they're starting to count calories, and they'll see, wow, you know, I wasn't really sure or didn't realize what I was eating or how I was doing it. So even more so than knowing the numbers and stuff is actually to just really consider, what did we eat during the day? You know, we have to include everything, even the snacks or the little extra cookie and that type of thing. Really can be an eye-opener, help us with our diet. Increase muscle strength and stamina. So this is important. We want to, I like to encourage people to incorporate a little weight training or in their routine. It doesn't have to be every day. It could be even once or twice a week, but actually lifting weights. We hear a lot about walking and this and that. It could be resistance bands or free weights or something like that. Simple, that can be done at home, but some resistance is good for maintaining muscle tendon tensile strength so that we have good flexibility, good range of motion, and we maintain our strength through a range of motions and decrease pain, soreness, and the possibility of injuries. The next one I have listed here is I just put stop dementia. So dementia and cognitive decline is a real important aspect of our aging process. In the best thing that we can do for that is to increase what is the REM sleep part of our night. So we have non-REM sleep and REM sleep. REM sleep accounts for about 25% of our sleep cycles through the night. And we want to talk about getting, I said already, go to bed early, you know, or get to bed by 11 asleep so we can have a big release of growth hormone naturally. And then we want to get through at least 5 or 6 cycles of sleep. And if we consider on average, maybe a cycle is about 90 minutes, we're going to need 7.5 at least hours of sleep to 9 to get through 5 or 6 cycles. The more cycles we get through, the more REM sleep we have. And we know from studies that REM sleep is great, is a fantastic deterrent to any cognitive decline or dementia that we may develop later on. So REM sleep is simple. It's there for us to take. We just have to avail ourselves to it. So another plug for sleep. Maintaining healthy bones. This is a weight-bearing exercise type of principle. So this goes in with strength training, but weight-bearing exercises. So it's hard to, especially if we have painful joints, but, you know, walk, jog, run in that order. I don't think jumping or calisthenics is actually necessary, but if you can do those things, that's fine. I like cross training and mixing in some bicycling or rowers machines or ellipticals and swimming, but weight-bearing activities we should not eliminate completely unless we absolutely have to because of painful joints. So weight-bearing maintains what healthy bones we have, and we'll talk a little bit about how we can also treat that. And then we want to have a healthy cardiovascular system. We want to rejuvenate our sex drive and our performance as we age. It's a problem. It really mostly relates to the cardiovascular system and blood supply. So all the above options will help us as we do that to maintain our cardiovascular system so that we don't need to take medications or pills in order for that part of our life to still be functional and working well, okay? All right, so I got 4 scenarios here that I want to go through of hypothetical patients. And then we should mention, I guess, too, Amanda, I guess at the end we'll do some question and answer, or that way I can just get through some stuff in there. So we'll talk about, these are all hypothetical patients, but first is 65-year-old female, approximately, who has, in the fall and winter, has a chronic cold or cough. They're tired. They have multiple doctor visits, diagnosis of bronchitis, pneumonia, sinusitis. They feel weak and tired. They've been on multiple antibiotics and steroids over time, cough suppressants, everything you can imagine, and they just can't get better. Some of this can be due to a reduction in their immune system function. So we have to think about the immune system as we get older, its function in innate immunity, and that's what we're able to, how we're able to fight off infections or viruses, or any type of the common cold, if you will. So our immune system can suffer as we age, and so we want to talk about how to improve that. So we talked earlier about controlling inflammation in the body. That's probably the biggest problem that our immune system will encounter, as far as its function will decrease as our total body inflammation increases. So we really want to combat that as best we can. So a lot of the principles here we've mentioned, and we're just going to reiterate them and give some little pointers towards how we can improve. So sleep is vital to immune system function. We want to improve our sleep. Diet, once again, so we want to have proper nutrition, fruits and vegetables, avoid high sugar content in the sodas, etc. Exercise, a consistent routine, so that helps with our sleep, but it helps our body function well, and it also helps the immune system. So we want to talk about decreasing inflammation in the body and our well-being, and so that would be to reduce stress. So ways that we can reduce stress is the exercise part of things, but that doesn't have to be necessarily a physical type of activity. It can be yoga or meditation or just having a positive outlook. There is some good evidence and some good studies have been done that whenever you perform an act of kindness or do goodwill towards someone else, that you actually receive a benefit internally through release of different neurotransmitters. So those things actually are helpful to us, and they give us a better outlook on things whenever everything else seems to be going badly. So this is a good time in life to do something nice for someone else, even though it seems like the world is crashing in, and you'll probably have a benefit from that and reduce stress level for yourself. One practical thing, CBD oil, we can get that at many places now, and that is an effective anti-inflammatory, and it has a good response for some folks, and that's something simple to try that you could get at various places at this time. I mentioned vitamin D3 here again with the immune system. I think it's very important, and that's something simple to get. Most people can tolerate 10,000 international units a day. So that's what you can look at whenever you're going to the store, and not get their level too high, but raise their vitamin D level to a proper value, which will then be able to saturate those receptors in the immune system and cause it to function properly. 2 things here that I'll mention as far as additional things that you would need to see physicians for: hormones. So various hormones that can be optimized and given back to the person from a bioidentical hormone replacement therapy standpoint are to decrease total body inflammation. That's what they're fantastic at. We really lose that ability as our hormones decline, and that's part of the reason why we have some of these problems as we age. So that's something to consider. And then also genetic testing. So we can do genetic testing now in different ways, and we can do it specifically for different problems. And the immune system is something that we can look at specifically with the genetic panel to look at exactly how each person functions and what supplements or changes would actually make a difference in their immune system function, specifically to them based on their genetics. So that is one other option we have to us. So let's go on to another patient here. We have someone who wants to achieve weight loss and is having difficulties. This may be somebody younger, 40 to 45, male or female, and they've just gained some weight over the past years. Females maybe see more in their thighs and their hip area. Men see it around their bellies and the love handles, and it's just a change for them, and they can't seem to lose the weight. They're trying different things, diet and exercise, and they're unable to get back to where they think they want to be or where they should be. So they're having trouble. So some of this can be hormone related, but some of the things that to consider from your diet standpoint would be thinking about intermittent fasting. So intermittent fasting is a great way of weight control or even weight loss. There are several ways to do it. It's healthy, and it's less restrictive from a diet type of standpoint, in which you don't have to be so concerned about counting calories or exactly what you eat. You still need to eat healthy, but what it is some will take the approach of 5 and 2. So 5 days a week, they will eat their regular meals, and then 2 days a week, they'll fast. So that is difficult, a little more difficult to do. Another intermittent fasting program that works very well is a little bit easier would be a 16-hour fast and an 8-hour eat in a 24-hour period of time. So consider eating from 11 in the morning until 7 at night, and still have to maintain a good diet during that period, a good nutrition during that time. But that is a good way to, and it's a little bit better, easier to maintain over time. And it really helps out with calorie control just by the way it's designed, and helps us to eat a little bit better during those times. So intermittent fasting is a good means of weight loss. It's safe and effective. It's medically a good means of losing weight. Exercise, once again, consistent exercise, I think, is the best thing. I don't care. It doesn't matter what you do. It's just being consistent with it and maintaining it over time. Your body will respond and adapt. It's good to change things up. And I mentioned a little bit of cross training, but some weight-bearing activities, some resistance activities, some endurance activities, and any means that you can get those things. It doesn't have to be a gym, but gyms are helpful. Can get you a good exercise program. Sleep is extremely important for weight loss, in that one of the big things is what we mentioned was the growth hormone release. So that is a fantastic recovery period of time for us. So as we recover and heal from any activity that we did, so if we're trying to lose some weight and we're working out, we need to recover, or else we're gonna actually, we may hurt ourselves, or we'll be so sore that we stop doing the things that we want, or these activities, and so then it become a detriment. So we have to sleep and get adequate sleep to recover from our activities. There's a story about Lebron James. He's just a basketball player, but a really good one. And he has all of everything at his disposal, right, as a superstar. But there are some reports of him sleeping 12, 14, as much as 16 hours a day, trying to get that much sleep whenever they're in NBA playoffs. So, that's a little extreme, and it may not have been completely honest, but the point is still there, that the science backs, sleep as extremely important in recovery from our activities. In this regard, with hormones for weight loss, there are two that are extremely important, can make a big difference. Thyroid is a great metabolism booster, And then testosterone, I'll mention testosterone is fantastic. It just eats away at fat. It just loves to gobble up fat. And your values were very high and at 16 to 24, and now they're very low at 40 years old. So that comes into play. With this, we can mention genetic testing also, because there are components of diet and exercise in a genetic panel that can point us to specific exercise or specific diets that our body will respond to better. So I would mention that. Let's talk about improving strength. So we have a 45-year-old male who is a former athlete, invincible all-star type of guy, who is now a laborer in the force and unable to keep up with his daily work. He's sore, he's tired, he's painful, he gets hurt possibly, and he just is a new life for him. He can't figure it out. Aging is taking its toll, and he's not able to respond. His body doesn't respond like it used to. Once again, diet we want to think about. And in this patient who is really putting in a lot of effort and work, we want to look and make sure they're getting enough protein in their diet. So we think about protein in the heavy work group, or even an athlete at 2 milligrams per kilogram a day. So that is very difficult to get in your diet, so you would likely need a supplementation. So there are a lot of shakes or bars that you can eat. So we want to think about increasing protein for these folks. Exercise, once again, the weight training is important. It maintains that muscle tendon integrity so that we can reduce injury. Sleep, as we've talked about for recovery from the work, is vital to these folks. Otherwise, they just keep on damaging their at the cellular level, and it builds and it declines actually to the point then where they can get injured. So sleep is necessary for our recovery time. And in these folks, some hormones can make a world of difference, testosterone, growth hormone. So they have to consider those type of treatment options if they're having difficulties with their daily activity. One more patient that I'll mention, and this is something that we can all probably relate to on some level, whether it's friends, mothers, or grandmothers. This is the menopausal female, and they really do have an issue with hormones. So a lot of this is a hormone replacement, but it can completely change their life, and it has for a lot of the people that I see. So we need to combat the symptoms of the menopausal female and try to help them with eliminating hot flashes and night sweats. We can improve their bone mineral density and decrease their fall risk or fracture risk if they fall naturally and not with some of the medications that are out there. This also is great for their cardiovascular system and can reduce the risk, increases their libido and their ability to still have good relationships with their significant others. Another issue is vaginal dryness, pain during intersex, and chronic UTIs. This is a lot related to hormones that we just don't understand or talk about too much, and it can really make a big difference in these women's lives. So I mentioned that as a more of a hormone replacement type of issue, but these things can be actually corrected, and they can regain their life in some respects. Sleep is so important to these women, and sometimes they have so much trouble with hot flashes and difficulties at night sleeping. So I want to mention that as a possibility for some treatment there for them. So that's mostly what I wanted to go through. I know there's quite a bit of repetition in there, and there's some of the things that are so basic, but I wanted to point out and try to give some insights or some different things to think about as far as the diet, exercise, sleep, some supplements or vitamins and things that you can get now, just by going to a drugstore, and to give your bodies the best chance it can have in optimal aging, and to have a better lifestyle and to maintain your health as you age. So I will answer any question if I can.
Tim had shared a question in the chat about asking what is the best antioxidant supplement. Kim, did you still have that question? I see that question. So, like, what is your opinion?
Yeah, I still had, I mean, I know vitamin D is actually more considered a hormone, correct, doctor?
That's right. Yeah, it is.
My first question is, I already do bioidentical hormones, but I don't necessarily trust my doctor. So where are you located? I'd love to set up an appointment. Where are you located?
We are at 403 Hyde Park in Doylestown.
Oh, okay, great. That's very close to me. No problem.
Yeah. So, yeah, we have the website's KephartIntegrativeMedicine.com. So, but yeah, we're right here in Doylestown. The other vitamin D is great, but and I mentioned melatonin, and it's something simple. You cannot, you have to take a little bit of melatonin too. So you'll have to look and see the milligrams on a bottle that you get if you go to GNC or Target or a pharmacy. But you may have to take 5 milligrams. You may have to take 10 milligrams to have the effect. But it's a fantastic. Melatonin, for me, is not exactly a sleep aid. There are studies that compare it to some of the drugs that we would prescribe as far as sleep aids that say it's equivalent to. But I like melatonin for its antioxidant, and even I'll say, anti-cancer. So that's a big term and that's a big deal. But there are good evidence and good studies that are showing melatonin as anti-cancer. So there's really no side effects. You have to watch a little bit. If you get too much melatonin, you may really have some vivid dreams, or the dreams may be, something that they complain or mention. So we might want to back off on the dose. But dreams, that stage is the REM sleep, which we know we want to have that as much as we possibly can for our cognitive, to prevent cognitive decline and dementia. So we have good studies on that. So melatonin for me is an antioxidant, sleep aid, anti-cancer, dementia. I mean, it does so much, very little side effects, and very simple to get.
I have a crazy question because I see CBD. When I look at CBD oil, I always think, what does that do? I pass it and I look at it. I never get it. Are there any downsides to that? I always think that everything's going to make me sluggish. So I'm really cautious. What do you think about that?
I don't think CBD oil will make us sluggish. It will be, the quality of it is really important because it is less regulated and you can get it everywhere. Right. You find it in really crazy places. You're like, why are they interested in this? Well, they're making money on something. So we have to do a little bit of research on where we get it from, but it is not going, I don't think it will make you sluggish, and it will have an anti-inflammatory effect. That is what we really are looking for it for. It will not be, so we see less side effects that you're concerned about because it is essentially an over-the-counter or something you can just go pick up. So it will have less of effect than some of the hormone replacement stuff that we may be able to do. And we can do that safely, but it would require more, intensive kind of treatment. But yeah, I think it's safe. I don't think you have to worry about side effects with CBD oil. I think we just have to be most concerned about where we get it, and that it's, good quality. And then it should provide an anti-inflammatory effect, which may be, may work great for you or for anybody else. And I don't do CBD oil or have it per se. I think some basic research, or I could even look to see, what would be a good supplement or something, a quality place to get it from.
I have another question, Dr.
Yeah.
Kephart. When you strive to replace the hormones in a woman, what age do you look to mimic, if that's the way to say it?
Yeah. So the menopausal female, and so the age can be whatever age they have reached menopause, but that female can benefit the most from bioidentical hormone replacement therapy. So before, in the perimenopause period, I cannot prescribe estrogen. So the body, they're still making estrogen. We cannot do that. But other than that, females can have any of the other hormones. And what we do would be just we use the word optimal, but we want to have them still in a normal range of laboratory values for each hormone, but we want them to be at the upper limit of normal. And as I said, we decline in all of these. So, we can sometimes double or triple a value and still be in a normal range. So estrogen is only for menopausal females, and everything else is for any other female who has a symptom or is looking for, to improve or, to cut back on their inflammation, their total body inflammation, and age well. We determine menopause usually, no menses within 12 months. And we still would like to do initially at least a lab value to be sure, because I really don't want to, not be a good situation to prescribe estrogen to someone who's still making estrogen, and we have a problem.
Right?
Yeah, hi. I have a question. Me and my girlfriend, we're currently doing an elimination diet, more so for her because she's had some gut issues and stomach issues, and her thyroid levels are a little high. But I was excited about doing it just to get free of, some pesticides and chemicals and all this stuff that's in all these food, and have this as a stepping stone for cleaner living. So my question is, are there certain types of like elimination kind of diets that you recommend or certain people to look at? And if in doing an elimination type of diet, what do you recommend for the amount of time? Because I've seen anywhere from 14 days to a month or longer.
Yeah. Really good question, and probably something that I am not, won't give you a great answer to. I don't have a problem with those diets or any diet per se, but in an elimination diet, I could see some value there. The word diet is just a difficult word because built into it is essentially some finite period of time. Typically, it is a situation in which you are putting yourself into such restrictions that you can't maintain that for, life, or you're going to have to change. So an elimination diet is different, and the timing of it, I can't comment. I think 14, 30 days, I think it may be just as much as you can possibly tolerate that for. I think there will be value in that. And then otherwise, from diets, I like to think about the way I eat in more of maybe macros, counting and looking at the carbohydrates and protein and fat that I'm taking in. And then intermittent fasting it can be safe and effective, and people can maintain that over time. And that's even a little tough. So I like to look at people write things down, look at their diet, and that is a much better way for them to see what they're taking in their body. As far as the elimination diet, I think that's probably wise and smart because, and it is for a period of time. And then you would have to, then go on some type of lifestyle eating regimen that would, fit for you. I don't exactly have a time frame for that type of diet or an example of a good one for you. Sorry.
Right. No, that's fine. I appreciate it. And I mean, I only use diet to go with the elimination part of it. I mean, after we're done, however long of an elimination we want to do, it really is about just adopting a healthier lifestyle and deciding what we want to keep out of our diet and what we want to keep in. And I apologize if I missed this. Did you comment on gluten at any point? Like, how do you feel about gluten and gluten-free?
Yeah, I didn't comment on gluten. Gluten seems to be an issue, or more and more, and we're seeing a lot of you know, the health food or the stores, you know, are catering to us now, you know, as far as gluten. What I do with any gluten or any of those other sensitivities, for me personally in practice, I do a genetic test, see exactly what you are sensitive to, and then we can either supplement or tell you to avoid those types of foods. So if somebody's having some GI issues, genetics, I have found now recently, you know, within the last year and a half, has been my go-to as far as determining what your sensitivity is and how we manage that. There's nothing better than genetics at this point in time. So we've come a long way with genetic testing, in that now we can use it for clinically. So I can actually do a genetic panel and see what your individual genetics say your sensitivities are, and then we can come up with a good management strategy. So that's usually the way I look at any of those GI sensitivities.
Right. All right. Thank you very much. Yeah, and that I mean, that makes sense. You can't get any better than having a very specifically customized diet to your genetics. So
it's been a little bit of a game changer, you know, and it hasn't been around forever. It's, you know, the genetic side of things. I use that in laboratory studies a little bit to guide treatment. Now, obviously, some of even BHRT is still symptom generated and controlled, but for the most part, we can follow those things with genetics and laboratory studies now. So, and the patient actually improves. It gets better, but it's because there's a little bit of, you know, it's data driven, it's science driven, if you will, and so it actually works because that's the way they're designed. That's the way they're put together.
I know you mentioned that you don't treat the hormone replacement with someone going through perimenopause, but is there any type of supplements or things that you would recommend for somebody, myself, who's starting to go through that now?
Yeah, we just wouldn't do estrogen. What we would do, we can do a lot of other things and it depends a little bit on the patient's goals, but there's a lot of strategies for maintaining, like I said, cellular inflammation, nutrition, and then energy production at the cellular level. So, yeah, there's about 12 different supplements and or medications besides estrogen that can be used to still, in a perimenopausal female, to improve upon their health, help them with a number of different issues that they may have, including just, you know, this anti-aging type of topic. But yeah, so there's a lot of things that we still do. Really, we just stay away from estrogen for those folks.
Thank you.
Yeah.
Eric, back to Kim's question. Kim, were you asking what age they try to replicate?
Oh.
Is that what you were Bye, Ogden. Ogden has to go. Thank you. Great to see you. She's teaching a yoga class, so.
Perfect.
We should all leave here and go take your yoga class. Thanks. But anyway, Kim, is that what you were asking too?
Yeah, I mean, I've read Suzanne Summers' books because they're very helpful in understanding BHRT, and I've read other people's perspectives. So some say, you know, aim for like 35. I heard Dr. Kephart say you felt your best between 16 and 24. But like, so if you're going to give estrogen to a menopausal woman, do you supplement? You don't supplement what she would have made at 16, would you?
No.
Okay.
No, that's a good question. So yeah, and that's a little twist on that. That's definitely different than what I answered before. So it's good. And you mentioned Suzanne Summers, and so I trained with Neil Rosier from California, who was Suzanne Summers' doctor there for hormones for a long time. And I think she mentions him in his book, or he mentions her in his book. So no, what we look for as far as a hormone level is we do follow the laboratory studies there a little bit, and I will stay in the normal range, I will say. So lab studies go anywhere. So this is an example. And then, we can extrapolate it to any of the other hormones. So in men, testosterone level on a normal laboratory panel from Quest would be 300 to 1,000. So that's the range. And if I if I do a lab test and I see that it's 400 for, a 45-year-old male. So what I can do is increase their testosterone level through supplementation to, usually I would tell them 800 or 900. So I could double their value. They would still be within normal, or the upper limit of normal for that lab test. And it goes the same for most of the other hormones. If we're doing estrogen, we usually start at 1 milligram if it's tolerated, and then we increase that a little bit. But the idea of estrogen is just to have some present. We do a laboratory study, but once you go through menopause, we don't have any more. So we just want to have it. We don't need to be 16, 24-year-old Superman or Superwoman anymore. We need to really, it's almost a matter of just having it on board so that it can still perform its role in the body. And it doesn't have to be at an extremely high level. So I don't look to try to get the 24-year-old values or even 40-year-old values. We look to symptom control is one, and then we want to stay within pretty much a normal range of lab value, which sounds like you wouldn't be doing anything. But if you look at the level when you start, if it's 0, and I go to 2 because that's normal, I've just, made a huge difference in your life. And now you are, you have you have the hormone to work. So it's not exactly getting you to a certain age where, a lab value that you were at an age. That was just an example of, whenever you did have all those hormones, you were doing pretty good. And now we tested and it's like 0. No wonder we don't feel well, sleep well, perform, with our activities, et cetera, do things well. And BHRT is natural, if you will. So that's the term, bioidentical hormone replacement. So we're giving you back what your body had before. So that's really important. It's not, medications these are compounded in a pharmacy and they're exactly what we say we want them to be. So we're not, they're drugs, but they're not commercially available per se, and that we're doing exactly the molecule that your body has always had. And that's really important whenever you consider putting something into your body.
Right. It identifies with the receptors. Yeah. My dad used to own a drugstore down near the Doylestown area in North Wales. And I remember filling prescriptions for Premarin, I believe, which is horse estrogen. And there's no part of a woman who is a horse. So, yeah.
Yeah, that's exactly
agree with that, right?
Yeah. But and I guess the point is we can still do BHRT and prescribe estradiol, E2, and that is exactly what the woman needs. And she can get it safely and effective and have the effects. So, yeah, medicine has made some mistakes along the way, but we can still learn from our mistakes and still do things right.
So last question, then I have to run. So I'm currently do BHRT, and I'm up to go for my 6-month checkup, but I think I'd like to transition to seeing you. So can you transition from one BHRT doctor to another, and how would you recommend it? Like if I were to get blood results, could I just bring them to you, you interpret them, and then we can transition like that?
Yeah. The
Okay.
laboratory studies are fine no matter who would order them. And I usually ask people, did you have labs done recently? Bring what you have. I don't want to repeat things.
Gotcha.
I'm not ordering something totally different most of the time. If I need something, we could get it, but that would be fine. And that's a good point too, as far as any BHRT program. So I tell people, most people who start don't want to quit. If everything is going well, they have the benefit. It's such a better life even, they feel better, but you know, I'm looking at the medical side of things and seeing all these benefits for them, you know, behind the scenes, but they don't want to stop. But I always tell them, if you're done or you have to stop for any reason, etc., you can stop doing BHRT. What happens is your values, your laboratory values, go back to nothing. You won't feel the same, but it doesn't cause a problem. It's just like aging. You know, you go back to what you would normally be if you were now 70 years old and didn't have any supplementation. So yeah, you can switch, you can change, you can stop and start, you know, all those things. With BHRT, and lab studies are lab studies, so we can look at them and see if we need something else or use them to go with as far as treatment.
Great. You've been so helpful. This is wonderful. I can't wait to meet you.
Great. Thank you. Look forward to it.
Thank you, Kim. And thank you
Bye,
all
everyone.
for attending. Was somebody going to say something? Did I just cut somebody off? Okay. Eric, thank you so much. This was really informative.
Thank you. Thank you.
If you can send the PowerPoint, I can get that out.
Yeah.
And hopefully I did okay with recording, because sometimes I don't. But I'll get that to everyone as well. So thank you very much.
Great. Thank you all.
Thanks, everybody.
Thank you. It was great.